Good day. My name is Diana Carangay, a student nurse from San Pedro University, and today I'll be demonstrating to you the proper procedure of taking vital signs. First, we must gather our materials. The materials needed are stethoscope, tickler notebook, oximeter, thermometer, BP cuff, disinfectant pad, and alcohol. After gathering all the materials needed, we will be verifying the patient's identity by following the facility protocols using two identifiers to identify them. Ma'am, may I know your name?
Jellicle,
When is your birthday?
September 19, 2001.
After verifying the patient's identity, we will provide privacy by locking the doors. And this time, I'll be introducing myself and explaining to her the procedure that we will be doing for today. Hi ma'am, my name is Nurse Dani, and I'll be your nurse for today. I'll be taking your vital signs, is it alright?
Yes.
After getting the consent from the patient, I will be performing hand hygiene using the alcohol. After performing hand hygiene, we will be getting the patient's body temperature using the thermometer. Before using the thermometer, we must disinfect it using the disinfectant pad. And ask permission to the patient if it is alright for the nurse to put it or they prefer they will put it on themselves. Ma'am, do you... As we wait, we will take the patient's oxygen level using the oximeter. Now we will wait. After getting the patient's oxygen level, we will take note the patient's oxygen level in our tickler notebook. Even the thermometer has beeped, we must wait for at least a minute or so to get the to get more accurate reading. Now, ma'am, after after taking the temperature of the patient, we will be disinfecting it using a disinfectant pad. And record our findings to our tickler notebook. Now we will get the patient's pulse rate using the radial method. Now we will be taking the patient's pulse rate using the radial method for at least a minute. After getting the patient's pulse rate in the using the radial method, we will record our findings to our tickler notebook. Next, the apical. We will be taking the patient's pulse rate using the apical method. After obtaining the patient's pulse rate using the apical method, we will be recording our findings. And disinfect our stethoscope using the disinfectant pad. Now we will be getting the patient's RR, but we must not tell the patient that we will be getting her RR because it can greatly affect the patient's breathing patterns. We must use other methods or styles to get the patient's RR, like pretending to get their pulse rate using the stethoscope, or just holding the patient's shoulder and uh, and uh, and observing her breathing pattern. We must do this for at least a minute. After obtaining the patient's RR, we will now be taking her blood pressure. After taking the patient's RR, we will be recording our findings to our tickler notebook. Now, we will be taking the patient's blood pressure using our BP cuff. We must make sure that the patient's arm is relaxed. After taking the patient's blood pressure, we'll be recording our findings. To our tickler notebook again. Now, we will disinfect our stethoscope after using. The patient's vital signs, she appears to be normal and healthy. Now, we will perform hand hygiene after all the procedure that we have done, and inform the patient that the procedure is already finished. Thank you.